like to acknowledge the leadership and mentorship of both Dr. Atway and Dr. Tu, who helped me through this entire process, along with Olivier Ricks. And of course, so indebted to Tom and Francie Hiltz and the Schott Foundation, because none of this would be possible. This is the greatest moment in the Brain Tumor Center's short history, for sure. You know, 30% of patients with cancer will develop a brain metastasis. And there's so many unanswered questions. For example, why is it that some tumors, like melanoma, will go to the brain 70% of the time, whereas some cancers, such as ovarian, maybe 2% of the time will metastasize to the brain? We don't know why. What about lung cancer patients? They're often first diagnosed with a brain metastasis, whereas if you compare them to breast cancer patients, they may show up with brain metastasis 5, 10, even 15 years later. So with all these unanswered questions, the primary purpose of the UC Brain Tumor Molecular Therapeutics program is to focus on these issues and others that I haven't mentioned, but with the ultimate goal of developing new therapies for these patients, innovative therapies, and if I may be so bold, to ultimately prevent brain metastases from happening. And I think that's possible. That is, we can intervene early enough in the process if we do the right kind of research to prevent these from happening in the first place. Then neurosurgeons and radiation oncologists will be out of business and will be very happy because nobody will have a brain metastasis. But I think it's the holy grail, but I think we can do it. As you've heard already, this unique program stands at the intersection between UC Neuroscience Institute and the UC Cancer Institute. And it's housed within the UC Brain Tumor Program. It's a collaborative effort. You mentioned the institutes, but let's talk about departments for a moment. It's the Department of Neurosurgery, the Division of Hematology Oncology, the Department of Radiation Oncology, and all the clinicians that are involved in this. We plan to recruit 3 brain tumor researchers over an 18-month period. The most important of whom is the director of the program, and that's the Harold C. Schott Endowed Chair. That's what it's allowing us to do, to bring in a world-renowned researcher who would come because of the program that we're building, but also because of the recognition of the Schott Chair. This person will have a major track record of successes in research of brain metastasis and will help us lead, direct, and recruit for the program. We will also recruit 2 additional brain tumor researchers, and their focus will be the areas of research that we think can translate most quickly from the laboratory bench to the patient bedside. Now, all of that research will take place in this building, and it'll take advantage of other incredibly talented brain tumor researchers that are already in our program that are focusing on primary brain tumors, because we don't want to give the impression that we're leaving that area. No, we have 2 areas of focus now. And we'll take advantage of the existing resources you may have heard about. For example, the UC Drug Discovery Center. This is very important if we're going to bring a laboratory discovery to the patient care, that in between we have a drug discovery unit, and we have such a facility. What's also very exciting to note is that we formed an external advisory board, and we have some very distinguished scientists who work in the area of molecular biology of brain tumors. For example, institutions such as MD Anderson and UCLA. And these experts will help us identify the top-level candidates for this program. We need their help in identifying the best and the brightest that we can bring to our program and develop the center. Now, I want to make sure that you know this is about research, but it's also about comprehensive care of brain metastasis patients. It's top to bottom focus. So for example, in the area of patient care today, and you can go to your computer right after this and put in ucbraintumorcenter.com/metastatic. There's a new sub-site that's dedicated just to patients with brain metastasis and their special needs. It's an interactive site. It's basically one-stop shopping for all information, treatment options, clinical trials, research findings, patient support group. We feel it's important that brain metastasis patients have their own site because of their special needs. In addition, we've initiated a cancer companion program. This is in conjunction with the wellness community. We're going to have newly diagnosed patients with brain metastasis paired with a volunteer who has specialized training. That volunteer will have a similar diagnosis, let's say lung cancer, similar age.